Welcome, everyone. We are recording and we're waiting just for the First Lady to join and for other folks to get here. I think we're approaching critical mass.
Are we? Okay. Okay. Hello and welcome back, everyone. Um, Happy summer. Thank you for joining. Thank you for all the work that you're doing. I want to share a disclosure as always that this meeting is being live streamed and recorded. I'm excited to be with you after a break and that allowed the subcommittees to meet and start diving in the work. It sounds like people are just are kindred spirits and learning a lot from each other, and we deeply, deeply appreciate your time and your collaboration. Our agenda today is packed with a lot of helpful information and exciting progress updates. First, we're going to have Deputy Legislative Director to the Governor, Morgan Gratz-Weiser, will present on the outcome of the legislative session and the bills that are related to behavioral health workforce, including bills that passed and bills that didn't quite make it. Afterwards, each of the subcommittees is going to talk a little bit about an informal update to the council about how they're applying the framework, how the workflow is going, and then planning for stakeholder engagement. We're going to have Vice Chair Eli will go first to talk about licensing and credentialing. Then we're going to take a 15-minute break, and we're going to do that to make sure that some folks who are, you guys got a lot going on, so the break is important for people to be able to make some phone calls. So I want to actually hold the break time this time and not roll through it. And then Julie will speak to recruitment and retention, and then Robin will be following up with the education and training subcommittee. As always, if you have questions as we go, feel free to put the questions and answers feature on the Zoom or raise your hand. The email invitation you received came from Chad. The email and phone number should be in there. Please call him if you have any technical issues. And then lastly, just mute yourself if you aren't speaking to reduce background noise. I also want to say extra thank you for the staff for doing all the preparation. Thank you, Morgan. Thank you for coming and having these conversations. We're looking forward to it. I want to we have about 25 minutes and then let's have her go through all of it, and then we'll take questions at the end. And so I am excited to hand it over to the fabulous Morgan to talk about the legislative session.
Thank you, First Lady. I am going to do my very best to share screen. Okay. Let's see if we are there. Then I'm going to attempt slideshow operations. Can I get a confirmation that this is visible?
We can see your split screen.
Oh dear. Is that still a split screen situation?
It's perfect.
Are you sure? Okay. Thank you, Taylor. So moving this around so that I can hopefully still see your faces. All right, as long as you are seeing the main screen, here we go. Thank you, everyone. My name is Morgan Gratz-Weiser. I use she, her pronouns, and I serve as Deputy Legislative Director in the Governor's Office. And it is my privilege to be here with you today and to share an overview of, in brief, how session went and to highlight a number of behavioral health bills that went through the process. There will be a couple of folks that I might call on throughout the presentation just for some added information. So in brief, I'm going to do a real quick overview. We'll talk through a number of bills. We'll do a little bit more deep dive on House Bill 2024, which was the primary workforce bill. And then I'm going to do a run through of some of the key budget pieces because as with any big policy area, it is both policy and budget that makes up the success of programs. So to jump right in, we have just to zoom out on the session. It was a big session. We had the most bills introduced out of any legislative session. Well, I think one thing that's notable is that we had dedicated committees in both the Senate and the House around behavioral health. We had the House Behavioral Health, Healthcare and Behavioral Health Committee chaired by Representative Rob Noce. We had the Senate Early Childhood and Behavioral Health Committee chaired by Senator Reynolds. And that really, I think, helped elevate the conversation and dialogue on multiple behavioral health issues in a way that hasn't necessarily happened previously. We also saw really strong engagement from both Senator Kate Lieber and Representative Tana Sanchez, who are our Ways and Means budget co-chairs, as well as some new folks in the conversation. We had Representative Walters and Representative Highfam, and it was bipartisan. Representative Deal, Representative Harbeck joined and supported on multiple issues. So it was really exciting to bring in new voices and have some really good dialogue throughout session. I do want to note, I think something that was new this year, the legislature bases the biannual budget on the May budget forecast. And this was the first year that we had a relatively flat forecast. In general, oftentimes the forecast goes up a little bit in the spring. And so that is what we use to identify the resources available for the work ahead. And so because it was a pretty flat forecast, that meant that there were some additional cuts to certain current service level programs that would allow for limited investment in new programs. But many of our budget asks when we started the session did have to get pared down and reduced to a smaller amount for what was actually passed. So just level setting that. But I do want to acknowledge there was a lot of broad conversation. There was really good work on civil commitment, on aid and assist, adult and youth behavioral health capacity, workforce development, and primary prevention. So I think it was a good session. A lot of good work happened, and we are also really well teed up to keep this work going and to bring in more legislators and build the conversation. So to jump in, starting with House Bill 2024, this is our primary workforce bill. We'll cover more details on the next slide, but this was the main start. I do want to note that when we started session, the governor also introduced Senate Bill 142 to increase workforce investments, and the universities and higher education community also introduced House Bill 3129. This was an area we had a lot of discussion, a lot of negotiations. There was also some budget scaling, and so those three concepts were amended, pieces were taken out, and combined into House Bill 2024. House Bill 2005 is also a combination bill, bringing together one bill, House Bill 2467, covering the civil commitment process, and then one bill covering the aid and assist process, which was House Bill 3051. So the original civil commitment bill had made it through the process pretty broadly, and thank you, First Lady, for your testimony and support on that bill. It did end up needing some final amending towards the end, and so Representative Krupp, as the chair of House Judiciary, which had heard both of these bills, decided to combine them both rather than go through a further amendment process. So that part of the bill changes the commitment threshold and the definition of dangerous to self or others to include someone who is likely to inflict significant physical harm within the next 30 days. It adds a time parameter there. On the aid and assist side, House Bill 3051 was originally drafted as a response to the current Mink-Bowman litigation and the need to reduce the wait times for admittance into the state hospital for people who are found unable to aid and assist in their own defense. So we had dozens, possibly hundreds of hours of negotiation and compromise on this work, involving the Public Defense Association, the district attorneys, community mental health programs, our judges, Disability Rights Oregon, and a number of other voices. So this was a bill where not everyone's happy at the end, but we end up with a pretty workable next step. So that's exciting. The next bill is House Bill 2059. And I'm going to do a brief pause. Did Casey get elevated to be a presenter? Because I will pass to him.
Yes, indeed.
Oh, awesome. Casey, I'll pass to you around our residential capacity because I know you've been working on that.
Absolutely. So Casey Liddell, Senior Behavioral Health Policy Advisor to the Governor, and House Bill 2059 was our request for funding for building new behavioral health residential capacity that is partially in response to, as Morgan mentioned before, the Mink-Bowman litigation, where we need more places for people who are on aid and assist and guilty GEI placements, more places for them to go other than the state hospital. We also need more room for people who are on civil commitments and for people who just are seeking out a residential placement who need that level of care in order to deal with sort of whatever level of their mental illness they're dealing with. So we requested $90 million for new capacity building. We ended up receiving $65 million. There was an RFI process, request for information, through the Oregon Health Authority at the end of last year, where we got sort of a number of projects that could potentially be funded. We also organized sort of regional conversations with regional partners to ask them, what is your top priority in your region? What kind of beds do you need the most? What projects would you like to see funded? And informed by sort of all of that information, we have a list that OHA is currently in the process of reviewing, making sure that those projects that were identified are still feasible, still ready to go forward. But we anticipate that that funding is going to be resulting in the building of just over 200 new beds across the continuum of secure residential treatment, non-secure residential treatment, and substance use disorder treatment residential placements, as well as preserving about 128 existing beds. So it's a significant dent in sort of the need in our state, the need that was identified in the Public Consulting Group Residential Plus report, and we are really excited for some of those projects to get their funding and get moving.
Thank you, Casey. Okay, moving on to House Bill 2015. This bill was brought by the NAMI Oregon chapter to study and address barriers to residential treatment. So all in the good scope here. This bill is directing OHA to look at a broad scope of administration needs for facilities. This is including nurse staffing requirements, reimbursement methodologies, alternatives to the home and community-based waiver, housing discharge processes, and evaluating potential for capacity payments for these facilities. House Bill 3321 is the primary prevention bill. I do want to note there was a lot of really good discussion about primary prevention, and multiple legislators were really leaning in here. There were, I think, a number of bills that dropped and then got coalesced together around 3321. This is directing the Alcohol and Drug Policy Commission to develop and implement a state strategy on primary prevention to help prevent substance use disorder. The ADPC will be conducting a gap analysis of current prevention capacity and expenses, outline funding models, implementation strategies, and expected outcomes. The ADPC will also be collaborating with OHSU to develop and provide education and technical assistance for youth SUD providers. Next, Senate Bill 476 is around workforce licensing. This bill is aiming at increasing pathways to licensure for internationally educated physicians and practitioners. And it's more focused with the Oregon Medical Board, and it directs the OMB to create a licensure pathway for practitioners who have been trained and are certified by a substantially similar entity as they would be in the US for education and licensing. Senate Bill 537 is around workplace safety. We've got, this bill is creating new requirements across healthcare settings regarding violence prevention, and it creates two new programs, one at the Department of Consumer and Business Services, overseeing the rules of workplace safety committees and adding required violence prevention programs. And secondly, it directs the Oregon Health Authority to administer a new healthcare facility workplace violence prevention effort fund, which will provide additional funding for eligible home health and hospice programs, as well as hospitals to help fund that prevention work. And then I added House Bill 3835 as an honorable mention. This bill did not pass, but it's around youth behavioral health workforce. And this is based on the System of Care Advisory Council's multi-year work groups and recommendations to help keep workers in the field and help provide clarity for when and how youth with specified needs can receive care. That work and policy dialogue is ongoing, and we look forward to the legislature's support and partnership with continued efforts there. So I'm going to pass this over to Brett to talk about House Bill 2024. I believe I saw you there, Brett.
Yep, I'm here.
Cool.
Yeah, thanks, Morgan. And good afternoon, everyone. My name is Brett Golden. He, him. I work under the Behavioral Health Workforce Incentives team. Here to talk about House Bill 2024. So House Bill 2024 directs OHA to establish grant and incentive payment programs to support recruitment and retention of behavioral health providers, eligible entities. There's also changes to the United We Heal Medicaid program. We'll start there with United We Heal. So in the bill, new language to expand program eligibility to include recruitment and retention strategies through the supplemental Medicaid payments. These funds will help providers receive higher wages, benefit training, opportunities, and improve workplace standards through labor management, training, trust. So this is a really great step forward in the right direction in supporting students, especially entering the behavioral health field through alternative pathways. So really excited about that. And then we also have the behavioral health workforce incentive component of the bill, which is what our team is tasked with implementing. And so this is to grant funds to eligible behavioral health entities, including outpatient and residential facilities, tribal nations, organizations that have a certificate of approval, and then programs that provide medication-assisted treatment, to name some. And the incentives are geared towards education, so loan repayments, scholarships, stipends, and tuition assistance, and the focus is on supporting providers that provide services to our underserved and historically marginalized communities, our publicly insured, rural, and other priority populations. So we're really excited about implementing these funds. Our goal is to have these dollars out in Q4 of this year.
Thank you, Brett. Okay, I'm going to pivot to budget. This will be a rapid fire round here. So just to provide that overview, while many asks started higher and were brought down a little bit, we still have some really strong investments. As Casey mentioned, with the behavioral health residential treatment capacity for adults, we're looking at $65 million. This is general fund, again, aiming for about 196 new beds. For youth, we were able to secure $10 million. This is also general fund to expand youth residential capacity for treatment and support services. This also includes additional new psychiatric residential and SUD treatment beds. The funding is directed to focus on mandated populations as well as regional and cultural diverse needs. Permanent supportive housing, we have $5.2 million. These are grants to organizations that oversee the behavioral health permanent supportive housing programs. This is for sustaining operations and keeping individuals housed. For the flexible housing fund for discharging patients, that's $3 million of general fund that will provide transitional housing assistance for individuals who are under an aid and assist order who are exiting the state hospital. This is an important continuity component here. So we were really glad to get those dollars. For culturally specific youth suicide prevention, we have $1 million, which will support ongoing youth suicide prevention efforts. For community behavioral health treatment, that's $7 million of general fund to expand community-based treatment for youth with high acuity needs and to integrate substance use disorder treatment into the intensive in-home behavioral health treatment model known as IIBHT. And then we have an additional $6 million for school-based mental health treatment for youth. That is slide 1. And to continue, we were able, as part of the aid and assist package, to get $10 million for our county partners. This is general fund to increase the community restoration service capacity. For deflection and diversion, also for the community mental health providers, $13.2 million. This is general fund to continue deflection and diversion programming. That is funding for distribution to the community mental health programs. The Harm Reduction Clearinghouse got a one-time $10 million grant, general fund that will be a grant to offer harm reduction supplies for community-based organizations to expand access to medications such as naloxone. And then for the Certified Community Behavioral Health Center, we've got $14 million. This is matched, so we actually end up with a total of $48 million. This is funding to sustain and expand the CCBHC operations and include additional 15 new CCBHC clinics in 2026. So that's very exciting. And then as briefly discussed just now, we have the behavioral health incentives with a total of $6 million. So as we noted earlier, things did get scaled. We started that ask with $50 million. It got scaled down, as did so many others, but it's a really strong start, and we look forward to continuing this work. And then I just want to say a big thank you. We had on the governor's team, Amy, Casey, Sarah, April, Chad, and Sarah. This work wouldn't have happened without this whole team, and also the entire teams of OHA, DHS, ADPC, and SOCAC. We had really incredible collaboration across all of our agency partners, and so this work wouldn't happen without them. So that's my presentation. Happy to take questions, and certainly will follow up if I don't have answers.
Fantastic. Thank you so much, Morgan. Just before we jump into questions, because I thought people might wonder how this relates. So I just want to make sure how it relates to the committees. Once a bill or a budget investment moves to the legislative session, it's signed into law by the governor, the impacted agencies will start working on implementation. And so if the implementation of a piece of legislation or a budget investment is related to the scope of your subcommittee, it should come up when you're discussing how to implement the recommendations that you're working through. So just to know that the plans that you're developing are going to be in alignment with the recently passed legislation. I know sometimes questions come up about how do these things all work, and part of the goal here is to bring everything into alignment and work into collaboration. So this is not, we still got the work that you all are doing doesn't change, but this will fold into that work. And so with that, yeah, let's do some questions. Tammy, you want to go first?
Thank you. And I'm not sure how much of a question versus just awareness and comment, as specifically around the noted House Bill 3835, the SOCAC bill that didn't pass. I guess I should say my affiliation. I serve as the executive director of Oregon Family Support Network. We are the family-run organization in the state, the chapter of the National Federation. I just want to also bring into awareness for this group that while that bill was supported by SOCAC, there was significant concern from families who would be impacted by those changes. And I was a little disheartened to hear, like, Morgan, when you said, we'll continue this, which is great. The conversation is great. And I just want to bring awareness that for those impacted that are not medical providers, there was significant concern across multiple agencies, including Disability Rights Oregon. So just want to bring that awareness to that particular bill and offer the family perspective there. Thank you.
Jamie.
I was just curious if there is a crosswalk on some of those budget items to where, as far as like, I'm curious about the school-based element. Is that end in OHA's budget? Is that in a different, but like, where could we get more information to kind of keep track of where things might land, where we might be able to access some funding?
Great question. And yes, apologies. I didn't have that lined out that way. I think we could totally pull this information with additional detail and share that back out.
That'd be great. Thank you. Robin.
Sorry, the mute button gets me every time. Yeah, and just to come back to that point, and maybe Morgan, you're the person. I'm hoping that the bills that align with the different things that we're working on, that our subcommittees will get that information sort of packaged for us so that we can use that in our conversations. Is that the plan moving forward?
I'll say I can't speak to the subcommittee work, but happy to work with our team to make sure that you're getting the information needed to advance the work of the subcommittees.
That would be fantastic, Morgan, because that will help us as we're thinking through what is actually feasible to know where there's funding and where there's not, will be critical.
Absolutely.
Shara.
Hi, thanks, Shira Marilla with Clatsop County. Um, First Lady and I were actually talking about this week. I'm curious if there will be room to include work requirements to the United We Heal dollars, as that doesn't currently exist.
I will say I am not the expert on that, but we can take that question and do some more digging on it. Any other questions? Well, truly, I'll say thank you for having me here, and always happy to do follow up as whether bills or budget items in this presentation, or if there's other items that come up in dialogue and you're looking for more information, I'm happy to assist.
Thank you, Morgan. Great job. Okay. Okay, so now we will transition to, and just so folks know, this is brand, this stuff is fresh up the, this is the legislative session just wrapped up. There'll be time to get questions, there'll be time to get information. Thank you, Morgan, for putting this together. But then there's lots of follow-up and implementation stuff that still has to get figured out. And so we're going to transition now to the subcommittee updates. And before vice chairs jump into their presentations, I just want to remind folks that around the purpose of the council and the exercises that the subcommittees have been going through. Because the council work happens, this stuff will relate to it, but the work still goes on. And that the council's purpose is to develop the behavioral health workforce action plan that's grounded in the recommendations of the HECS Talent Council. And there have been a lot of workforce reports that folks at the HEC went through pretty diligently. And what the talent assessment does is it pulls together these threads to outline what needs to happen to address the crisis across Oregon. The council's job is, and what people haven't done before now, is the how. And so some of the budget stuff will matter, and it is still also the how of how they should work with this funding, but also funding for the future. And so these things the legislative updates we still are moving forward with these recommendations, and this will be an opportunity to flesh that stuff out. And then Taylor, do you want to talk about the prioritization framework, because you do that in your best voice?
Yes, thank you so much, First Lady. Hi, everyone. Good to see you. So before we jump into subcommittee presentations, I just wanted to ground us in a sort of shared reminder about what this exercise is and isn't, because we have so much work ahead, and this was really a first step to help us get organized. And what I want to emphasize is that nothing here today is set in stone. And I know that as you all continue into your work, you might have new reflections that results in you wanting to shift things around and prioritize them differently. So just noting that this was a really initial and cursory categorization to help just inform the next step of your work. So if it is helpful, I just made a really quick slide actually just to illustrate. Let's see, are you able to see the slide here?
Yes.
Yeah, great job.
And unlike Morgan, I'm not going to be able to figure out how to put it into presenter mode. Great. Do you see the split screen or just the one screen?
Just the one.
Perfect. Okay, so as a reminder, there were 4 categories. There's do first, consider, hold off, and do later. The do first category is really for recommendations that you all decided were high impact and high feasibility. So going to have a really big impact, and it's really likely that this is something that you could get done. So the icons aren't perfect, but this is your rocket ship. You're like ready to go. So high impact, high feasibility. And for the specific recommendations that your subcommittee is categorizing as do first that meet these criteria, the hope is that you develop like an action plan to implement that recommendation. For the do second category, these are recommendations that are high or medium impact, but might be really difficult to achieve. For example, maybe it's like $5 billion, and in this particular budget environment, that might be very difficult, but these are really important recommendations. So these are our unicorn recommendations is the icon here. So they're really important. You want to do the work to move them forward, and it might be challenging to get them done. The third is the hold off category. So these are recommendations that may have a lower impact, but might be easier to do. So it's still worth exploring. They have some impact, easier to do, doesn't take a ton of time and energy. So it's also good that these are third on your list because it may take more time to think through like, oh goodness, how do we get these 2 sets of recommendations done? And then the fourth category is do later. So these are recommendations that have a low impact and also low feasibility, which means in public policy world, we call this like a low bang per buck. So it might be really hard to do, and there might not be a lot of impact. So that's the do later category. For these recommendations at this point, the hope is that the subcommittees would really think through high-level guidance on next steps, but not necessarily need to develop a full-blown action or implementation plan for these items, just appreciating that you all have a lot on your plates, a lot of recommendations that you are working through. And so at this point, the ask is for action plans around the first 3 and then high level guidance on next steps for the 4th so that there's meaningful feedback from the council on everything. But you're spending a lot of your time, brain power, and energy on these first 3. First Lady, anything that you would add or change?
No, that's perfectly said. Thank you so much, Taylor. We're just trying to make it clear that, the HEC recommendations all have value. And it's really important before the council disbands that there's some recommendation and guidance from people who are out there in the field, in our classrooms, in our credentialing organizations, and that there's some guidance there, but that it's not where a bulk of your time is being spent, but that there's still an opportunity to get your expertise on each of these recommendations. Not that they're all created equal. So we just want to clarify that is that as this has been moving through, and then we wanted to take some time to have the subcommittees talk about how it's going. And I also always want to say it's a work in progress. And that is, these are early presentations as people are starting to discuss what's working best for them and what they think makes the most sense for right now. But that's also changeable as they move through the work and come up with different things. And so just want to put out there that was part of the conversations that we had with each of the subcommittees is just, this is the current thinking. And I really want to encourage people to be able to have that. They will present and then we'll take questions per each sub. Does that sound okay? And so I will turn it over to Eli, he's vice chair, and he will walk us through a little bit about where the licensing and credentialing subgroup is how they're doing.
Yes, thank you, First Lady. First and foremost, for those of you that may not know me, my name is Eli Kinsley, he, him pronouns, and I just feel really honored to be in this space, share this space with you, collaborative space to be able to share ideas and really kind of think through this crisis that we're in a lot of ways and really kind of delve into the information that was presented from the report. It was really, in a lot of ways, at least for me, invaluable, and it's really kind of guided the conversations that we've had. And so with that, I really appreciate that Taylor kind of already outlined the process, right? So she's given us the framework. We've got the recommendations. Now, how do we synthesize that and to come up with some ideas based on input from various individuals in various parts of the field? And for me, that's also kind of been a really informative and really kind of rewarding process in itself, and just kind of listening, because I'm only in my little space of my part of my community and doing what I do, so it's been really helpful. So just to kind of help you guys to understand what that looks like, we'll go ahead and go to the next slide. Somebody could take us to actually the third slide.
Can you see the screen changing, or is it just me?
I can't see the screen changing.
Okay, here, let me try and change the display settings.
Taylor, it's being annoying and not letting you put in present mode.
Oh, I know.
I had this issue on a meeting yesterday and I was like,
Here, let me try again. I'll try and channel how smoothly Morgan did this previously. Give me one moment. I'll try this. Okay. Can you see, it's not in presenter mode, but are you able to see the?
Yeah.
Okay, and then this is where folks can like grab water as someday we'll get it. Let's see, resume slideshow. All right, does it still have it in just the split mode?
it does.
Okay, I might put you into just
But it moved.
Okay,
It
I'll
moved
move
to the
into
third slide.
All right,
Yes.
so you can start, and then I'm going to try and make it look better while you're talking.
Okay, perfect. Thank you. I appreciate that. So do first recommendations for us. Well, like with any process, you want to try to gather as much information as you can. So that was kind of our first initial steps. Of course, after getting to know one another, like all of you, I'm sure have done in your subcommittees, and some of you may have already known each other from other areas. But in terms of that information gathering, really kind of analyzed credentials and looked at what areas offered limited mobility, particularly career mobility. We tried to look at how we could provide maybe better opportunities to inform investments, right? We know that investments and funding is going to be limited, so what's the most we can get for our investment, and what's already there? And so I think one of the current bills is around workforce development currently might support that, and so thinking about that innovatively and how we can add to that through some of the actionable ideas that we might come up with, or recommendations. We definitely want to research best practices from other states, kind of see what's working elsewhere. I think that's always going to be, really important to really kind of create new ideas, because Oregon just doesn't do it the only way. Oregon does it this way, but we also want to do it as informed as we can from other states that are doing it maybe a little differently, and how can we enhance and build on that. Looking at some of those pathways into the profession. So what we know is there's not a lot of strong interest, unfortunately, particularly from our younger folks. There are some great programs in like high schools and CTECs that are doing some great and phenomenal work. How do we build on that? How do we continue to build interest for somebody that's really, rather new to the field? So maybe looking at adding tiered pathways into the behavioral health jobs that support education, promote the idea of a behavioral health technician, which we realize we definitely need to refine that definition, so it's kind of universal, and it offers its own pay matrix in itself, as a kind of a introductory pathway and for somebody to enter the field. Communicate how associate and applied science degrees from behavioral health workforce and professional careers and technical programs, are really a viable pathway. As a person that went through an applied science program, I wasn't really well informed. Like I kind of had to figure that stuff out on my own, with the guidance of some folks. But I was just really fortunate to connect with some really smart individuals that really kind of helped guided me through that process, amongst my own lived experience that had created barriers for me in navigating through that process. Looking at simplifying and streamlining. Now, we know that might be a little challenging, but can we work to create that crosswork of behavioral health credentials and licensure requirements that then kind of align with standardized coursework? Because it can get very confusing for those of you that are licensed or been in the field for a long time. How confusing it can be working through the various credentialing bodies and all of the requirements that you have to have in place through the various accredited programs within higher education. Hopefully we can streamline and standardize those licensure processes and requirements, and then make data readily available for others to access and analyze for us across stakeholders, and maybe enhance some of those, excuse me, IPEDSs and behavioral health data processes, protocols, so that we consistently capture, what the area of focus needs to be, what's most relevant, and gather as much current data as we can. Those do first seem the most feasible, might have the highest impact, might not require as much cost. So of course, that's going to be more realistic. And so, in having those conversations and looking at that. But once again, like I appreciate what Taylor said, we're not locked into those. Those are just kind of where we're at right now in these very beginning steps of the process. Second slide, please. So the due seconds, what we're going to consider, we've considered maybe providing funding for micro-credentials. I really appreciated Eric Martin's input on this. He said it's pretty easy process to do, but we definitely have to refine that and define what that really means, particularly around a behavioral health technician. Is that going to be something that it's relatively easy to do? We can create the credential for it, but we got to have a universal definition behind it. And so there might be some budget constraints that might make it less feasible to fund, but still the subcommittee would like to address what those micro-credentials within the context of streamlining and standardizing licensure processes might be. The ultimate goal is, we want to be able to provide wider access and, some meaningful application so that it can be realistic and be get a return on that investment. Next slide, please. So holding off, I always struggle. I never really want to hold off on all of it. I think I have a lot of energy like Amy does or First Lady does. I want to do it all, but can we really do it all? Unfortunately, we can't. Especially within the current climate, federally, funding is limited. It's just there's so many more things to consider. And what I also appreciated about the HEC assessment, where there were so many recommendations, but man, they all seem really good. But how do we decide which ones are the best ones? And unfortunately, these were some of the ones that just didn't quite meet that threshold that we could see would have the most impact and be the most feasible. So, funding large primary data collection initiatives that leverage that longitudinal data, that just didn't seem realistic. I think we, or at least most licensure organizations, they do a pretty phenomenal job of already tracking data, particularly workforce data, demographic data, OHA. I mean, I was just sent a OHA survey around licensure and associates a few minutes ago. So I think that the data is there. It's just how do we maybe coalesce it and bring it together? And is there a way for us to do that as opposed to funding some big project to get it all together, right? Maybe it just means getting the right people in the room. So, thinking about that, it just didn't seem like the most highest impact that it would have. So we kind of held off on that. Next slide. So do laters. Maybe what we can do later is create that state data center. I mean, that's five years down the road, right? We'll know we already have the data because we're already capturing it. But once again, how do we bring it all together? Maybe that's where we, hire those really smart people who gather all that and love doing all that. And, those data methodologists, and they bring it all together and they refine it for us, and we're able to present it to get funding for it. Maybe explore, to do later also is explore national initiatives such as the National Center of Interstate Compact. So that's, I was recently at the NASW national conference, and there are a lot of states that are currently doing that, which is great. But I think they're already kind of working on it, right? And so it's really maybe getting with our own local organizations that are part of those national organizations, and working with them and bringing ideas and maybe having them to come and lobby and figure out what that looks like, but not necessarily something I think that we thought that we needed to put a lot of time and energy into right now. As well as the National Mental Health Workforce Collaborative. Those things are happening. But once again, if they're national, that probably means that in a lot of ways they're federally funded. And so I think there's just a lot that we're just unsure of in the next 3.5 years, even now. So I think it's perfectly realistic to maybe consider those and do those things later. Next slide, please. Questions. I'll do my best to answer my questions, but I'm also going to invite my team and my committee into answering any of those questions as well. But some of the questions that we have for discussions are, how are we defining behavioral health technician? Oh, sorry. I think back to that other slide. Yes. How are we defining behavioral health technicians? And to what extent, these are some of the questions that we had for discussions. Should we align this definition with those used by other states? So some of the examples that were given is that we currently have a certification for a QMHA, Qualified Mental Health Associate, who primarily works with individuals who have a mental health diagnosis that then therefore provide more skill development. They don't diagnose, they don't treatment plan, but they are kind of almost the adjunct to that plan and kind of step in and intervene. But then we looked at, okay, we also have direct line staff that don't have a direct certification, that can't necessarily bill for services, but they are doing a lot of the similar work. So there's kind of like this overlaying of kind of skills and duties, and like, how do we refine that to create its own definition for that? So we kind of went back and forth in that discussion, but it definitely, we're asking also for input as well, which I'm hoping is going to be part of that stakeholder engagement that we do, right? Asking those folks who are also providing those services, that providing, the various variety of different types of work, and what would that definition look like for them, and align best for best practices in their own organization. Another questions for discussions that we had is, how can we align surveys and consolidate existing open data? So I kind of mentioned this a little bit. We have a lot of data streams that come in. My board, Board of Licensed Social Workers, OBLOT, Board of Licensed Management and Marriage Family Therapists, and of course MACBO, the nursing boards. Like, how do we bring all those things together and be, effectively leverage that data to improve policymaking? I mean, ultimately, we want to have informed decisions, particularly around policy. So those were just some of the questions that come up for us in our discussion and our kind of thought process. And what I appreciate is they're always evolving. It kind of almost takes us down a rabbit hole. And fortunately for us, we have kind of Casey to make sure we don't go too far into the rabbit hole and some of the other moderators in there. So next slide, please. Okay, so the plan. So we're still kind of working out the ideas. We've started formulating lists. I'm sure some of you all in your own subcommittees have started providing information to folks who definitely need to be a part of that conversation, because they will, in a lot of ways, be the ones that are going to be operationalizing the investments or the ideas that we put forward. And so their input is going to be valuable in how realistic that those implementations might be, right? How much of an impact they're really going to have. And so I'm actually looking forward to that. I'm a person that really values other people's input. I don't like to be the sole decision maker a lot of times. And it doesn't work. It doesn't align with Indigenous perspective either. So we have councils and people that come together. So looking at that, refining that, we're getting those names, we're offering them up, and we're doing our best to reach out. I think we'll do our best to reach out to those folks and invite them into that space. We're working on finalizing that engagement plan, and it is a top priority for our upcoming subcommittee meetings. And I really look forward to seeing who the group or body of folks and organizations are going to be. The last slide. Okay, questions. Like I said, I'll do my best to answer questions. And if I can't answer it, I'm sure there's somebody in my subcommittee that can.
Sorry, you cut out. Did you say my name or? Thank you, Eli. That was such a wonderful presentation and very informative. And as always, I'm always coming back to this medical perspective that I've come from. I actually was a behavioral health tech way back when. And just for everybody, I'm a psychiatric mental health nurse practitioner now, but I worked on a secure unit in a hospital. And one of the things I'm wondering if you're discussing is how to align CNA duties with behavioral health duties. So I would have loved to have had a behavioral health like official, license for a technician. But I also had a whole bunch of CNA duties like checking blood sugars that I needed to do. And I'm wondering, and blood pressures, a lot of our antipsychotics, cause hypotension. So I'm just wondering if there's any conversation in your subcommittee, in your work group, about how you might need to align with medical practice. And I think you have maybe Rachel on your subcommittee, so I'm sure she's maybe brought this up already, but I just wanted to speak up.
Yeah, actually, I do believe we did, and feel free to jump in, Rachel, because she was actually the one that was kind of informing me. Like, there's, CNA folks that we also want to consider. We just don't want to kind of restrict it strictly to somebody that's in behavioral health. So I'll even give our own example. So the organization I work with, or work for Bridgeway Community Health, we have our medically managed withdrawal. So we hire CNAs, but then we have our frontline staff, right? And it would be wonderful to have them cross-trained to still be able to take those vitals as needed, but then also have some behavioral health training to be able to help mitigate any kind of symptomology or immediate acute stressors that they're having through the withdrawal process. So I think there could be some marrying of those things. But if somebody else has any input, I'm more than happy to invite that in.
I can jump in, Eli, and thank you
Yeah.
for representing our subcommittee so well, and putting the things into buckets. And I think everybody probably is going through the same thing in their subcommittees of figuring out how we use the same language. And then as we're doing that, we're like, oh, wait, even in this group, there's some confusion and how we level set that. So it's really exciting to know we're moving forward, but we're still in the beginning phases. But this was one of those examples, Clarissa. And right at the time that we were kind of in a subcommittee meeting just talking about how that term, that HEC elevated behavioral health technician, and the way I think about it in the CNA space, I actually had one of the nursing clinical leads, educators from the state hospital reach out and say, hey, our mental health therapist, so their title is mental health therapist, had historically, and there's hundreds of them, had always been CNAs. And then COVID hit. They didn't have to be CNAs. And there was some work being done on how they kind of now go back and say, is it a CNA, the baseline that they need? Or is it something that really focuses on those with severe and persistent mental illness, but also supporting them? So those conversations are kind of starting. And I'd say the other thing that happened from us trying to get that language of what each of us shared in our own spaces and then level set and the confusion of just this group. So how can it not be in the larger field though um, is there that potential for that CNA that then gets that mental health training? And what does it look like? Are those that are the behavioral health technician, should they get the CNA training, or is that kind of too much? But maybe it's not too much because over the last couple of years, we removed the barriers and said we need the curriculum to be a little bit lower, so that they can get into the workforce. And then in that workforce, they get to train them for what does the hospital need? What does the long-term care need? What does the clinic need? Because it's all a little different. So how do you make the standard a little bit less so that then when they go into their settings, they have that. But then how do you get recognized for that? So yeah, it was a discussion, no real answers or anything, but part of the discussion of needing to kind of level set language and understanding and clinic titles, all the things.
Thank you, Rachel, for providing a little bit more clarification. That was really helpful. I see another question from Jamie.
Hi, yeah, I just wanted to pull the thread for you, if maybe you are aware, but I'm on the House Bill 4151, a subgroup, like a subgroup of a subgroup, and one of the concepts of that subgroup that I'm on is just the huge range of the QMHA. It basically spans, you can be a QMHA with, I'm not sure if you have to have a high school diploma, but just with experience, which is wonderful. I don't want to change anything about that. But you would also be a QMHA until the very, very last credit of your master's degree. If it's not even legally confirmed, you're still in that. It's a huge cross section of humans and experience. And so that subgroup was floating around the idea of, is there something in the middle where you have a bachelor, someone with a bachelor's degree that's in an applied psychology field? And does there need to be something in the middle there, a credential in the middle? And Eric with MACBA was involved in those conversations and could fill you in too, but just wanted to pull the thread if there's a connection there that you guys want to tap into.
Yeah, and I can jump in. So there's a mental health intern, which would be a QMHA that is in a qualifying graduate program that has a collaboration with the organization they're working at and the university, which would allow them to work as a QMHP. But there's really nothing in between other than that. And we can't credential qualified mental health interns. So it's just something that's written in the rule. So what we see all the time is we get variance requests where agencies request a variance to OHA. because they need somebody to be a QMHP. So I think there really is a need for it. And there's kind of precedent already set with the mental health intern in the OARs.
Eli, can I jump in real quick? Because I just want to say,
Absolutely.
I think what you just elevated is super important for all of us when we're in the council group to make sure that those of us in our subcommittees know about the other work going on. Because thankfully in this space, we know that Eric and Van, they're kind of partnering, are also on that one you mentioned. But I am hearing that maybe there are ones that there isn't a crossover and we should make sure that we're connecting. So I think that, because this obviously Van just showed, it was brought up and we are talking about it. But I think it does say we should always kind of do that when we're in this space to make sure of it. And if there isn't crossover, get there. So thanks for elevating that.
I've seen a question from Liz.
I just more wanted to echo what Jamie said. I think that there is like that huge difference between different QMHAs, and I think that that would be a huge benefit in like if there was different spots that they could fill, if there was two different credentials, I think it would be huge in addressing the crisis in general.
Yeah, fully agreed on that. Monica.
Just a couple things. There's a current pilot project, and it looks like Brett dropped off. But there's a current pilot project with OHA to actually use associate's degrees for the QMHA pathway. I didn't know if folks were aware of that. I'm sure Van is in conjunction with MACBO. So that was one piece. And then just the other piece, as far as the behavioral health technician, I think it would be a great opportunity to collaborate with the education and training committee to just sort of talk about what makes sense for what training should that person have, or what kind of education should that person have as moving forward. So those were my two little bits. Thanks.
Thank you. Shira.
This might be like too far down the road or too far in the weeds, but thinking about behavioral health access being a pain point for our population, like if there was a breakout of QMHAs who were, had their BAs in psych, like could they then do the initial assessment and treatment plan that covered the initial 45 days of care to get folks into treatment before then they get passed on to QMHP for like ongoing services, could be hugely helpful to that access point as well.
Great comment. And those are kind of like all of the, well, not all, but a good portion of like, we're trying to take in all those considerations. So access to care, improving workforce development, making sure that we're recruiting, the younger generation of folks that are going to show an interest in the field, right? Looking at how do we diversify the field, making sure it's the most diverse to the diverse populations, particularly in rural communities, right? That's where there's a significant amount of need, but we're not getting a lot of folks from those communities that are wanting to go into the field. Maybe it's just a limited access to education and the right career pathway, or not knowing about it. So in the licensing professional subcommittee, those are some of the part of the conversations that we're having. And like I said, initial stages, we're excited about it. We're looking forward to it. And of course, as we come together in this more, this bigger, broader space, all of that input is very helpful. So I appreciate all of that. So I think that's all I have.
And I'll just add that, I think, what we're trying to be intentional about is how do we consider cost, because we know that folks don't have a whole bunch of money to go get new certifications. We're thinking about efficiency. We're thinking about how do we not further cause confusion. And there's just all these elements that, I think it is, timely that we have this opportunity to look at, just because I think that it's a good example of how when you're so focused with the work that you do within your own kind of arena, be informed hopefully will help us with being able to get to viable solutions.
Okay, I love this. Rachel, I think I have to jump in only because
I get it. I get it. Go for it.
Only because I love this so much.
No, I get it.
I
Go
do
for
want to
it.
make sure that we get to the other committees, and I do want to give people a break. I don't think but I was hoping that we might be able to cut the break a little short so we could have more time for the committees. And if, how would people feel about a 10-minute break as opposed to 15? Okay, and it's 3 o'clock right now, which also allows us to, that's an easy thing to jump back in. So if folks would be okay to take a 10-minute break, do what you need to do, and then we'll jump back into the committee presentations. This is wonderful. Thank you. Okay, I think we're at getting close to critical math. So I want to keep us on track. I know sometimes if you're on a break, you might get called away to something else. Understood. But I want to just keep us moving. I'm so excited about the discussion and the expertise, and I just it's wonderful to see. So just thank you. And we're gonna keep rolling along. We're pretty much still on time as we're supposed to be. So great job. And if we go a little, or if we go over a little over, if people could just give me a few extra minutes this time, because we got, and I'll borrow it against the times we got out earlier, just so we can hear everybody and hear all the committee's brilliance. Julie, are you ready to take it away? You got a tough job.
Ready.
Okay.
So good afternoon, everyone. I'm Julie Ibrahim, she/her CEO for New Narrative, and also the vice chair for the recruitment and retention subcommittee. I'm honored to be included in this work. I think it's so important, and we're already having a lot of fun with it. So we've gone through 2 or 3 iterations of prioritizations. We have 29 items, so hang in there with me as I take you through our best thinking so far on those. If I could have the do first slide, please. Okay. In the do first category, we have listed 5 items classified under 3 key areas: supporting workforce, admin burden, and cultural representation in the field. These are the items that we feel are high impact, high feasibility. So under supporting workforce, we listed 2 items. The first is establish best practices for supporting workers and supervisors. We feel that this is high feasibility in that it doesn't have to have a huge fiscal impact, but it does have a very high impact on the workforce. Our workforce has a very hard job in an emotionally demanding field, and this is a very, very important aspect for retention. The second item in supporting the workforce is create programming within organizations that has supportive services, mentorship, and wraparound support built in for staff. We see this as especially relevant for our behavioral health staff that have lived experience that is so very valuable to our clients. For example, in my organization, over 40% of my workforce identify as having lived experience, and increasingly are understandably requesting additional support such as wellness days and extra work accommodations as an example. In the admin burden category, we have 2 items. The first is review and simplify administrative burdens placed on behavioral health providers and supervisors to strike a balance between ensuring high-quality patient care without overburdening providers. This item is widely supported and attempts to better balance care quality and administrative workload. The second item in this category is address the administrative burden on care providers and supervisors, rethink, revise, and simplify reporting, billing, and current redundancies in process and protocols. This was discussed extensively. From a provider's perspective, the impact of administrative burden is that it creates excessive administrative costs for providers, and those costs are rarely fully funded. But most importantly, it diverts money away from what could be applied for staff compensation. Our final bucket is do first is cultural representation in the field. This item is infuse principles of equity and inclusion to diversify and expand the talent pipeline. We'd like to point out here that there are many DEI-related recommendations from the HEC report, and you'll see more of them in my report. And our subcommittee believes strongly that we should be infusing DEI principles throughout all of the recommendations, and we intend to work on a structure to support that. There was a very pertinent comment in our last meeting about how many work groups and companies really separate DEI as a special project when it should be infused throughout everything. So we're going to keep that in mind as we work on our DEI items. Okay, do next. Thank you. The Do Next prioritization has the highest number of recommendations, and we have 5 categories. So I've got 2 slides here. The categories are culturally responsive workforce, incentives, compensation, cost of education, and collaboration. We grouped 4 items into culturally responsive workforce. The first one is increase the share of providers who are multilingual and represent populations that are underserved, underrepresented, and under-resourced. The second is use data to intentionally form initiatives focused on increasing workforce diversity. The third is identify and reduce barriers for BIPOC individuals seeking a career in behavioral health. And the fourth is creating programming within organizations that have supportive services, mentorship, and wraparound support built in for staff. So you'll see this support theme throughout most of these prioritization areas. Let's see. Hang on just a second. So I can put, more about the culturally responsive workforce. This bucket speaks to the well-established and compelling need for a more culturally responsive workforce, the impact of which is to increase access for marginalized communities and to provide more support for recruiting and retaining a diverse workforce. The next bucket is incentives with 3 recommendations. The first is to fund students in pre-designated areas and fields that are experiencing shortages and pair this with a 2-year work commitment. There are existing models for this, and this is also being examined by the HB 2235 work group. The second item is to increase opportunities for the workforce to learn evidence-based practices, professional boundaries and safety, professional writing and digital literacy skills, resilience and self-care, cultural humility, and team-based care skills. Now, our group feels that this recommendation will involve a combination of formal education, like in behavioral health, college programs, as well as on-the-job training and on-the-job support and supervision. The third is to offer regional specific behavioral health career roadmaps to encourage a grow your own approach for tribal, rural, and frontier communities, acknowledging that even with high compensation, it is difficult to recruit from urban areas into rural areas. The next slide is a continuation of our Do Next recommendations. So we have 4 recommendations in the compensation category. There was probably more debate about the prioritization of compensation than in any other item. Our subcommittee feels strongly that this is the #1 issue to resolve and has the very highest impact on recruiting and retaining behavioral health workers. The HB 2235 work group agrees, and I dare say every provider in our state feels the same way. And the only reason it's in Do Next instead of Do First is because of the financial feasibility of our current budget restrictions on both the state and the county levels. However, in spite of our current fiscal restrictions, we still believe that there is important work to do here in addressing and developing what financial levels and vehicles are needed for today's and tomorrow's behavioral health workforce. We need to provide the framework, the information, the gap analysis that the legislature needs to help us move forward here. Items in this category include addressing inequities between community-based and private practice providers. As you all know, we lose especially master's level clinicians routinely to private practice. The second is to develop a progressive reimbursement rate and billable services, which currently undervalue community-based healthcare. We must continue to advocate for rate increases that keep up with cost of living and operating cost increases. The third is to develop clear career pathways that are supported, well compensated, and sustainable to attract and retain a diverse workforce. And then the fourth one is explore and fund financial incentives for specialized workforce roles that align with union regulations and are equitable. This is particularly applicable to, I think, our crisis response services, which are notoriously difficult to staff consistently, but there is a high community need, particularly now. We know that the acuity in our community is increasing. The next bucket in Due Next is cost of education. Now, this is arguably a close number 2 to compensation in terms of highest impact on recruiting and retention. But again, categorized as Due Next due to fiscal constraints. But even in the face of fiscal constraints, there is much we can do to specify the what and the how of a more effective way to address the crippling burden of education costs on employees. The first item in this bucket is support financial aid, scholarships, tuition reimbursement, and loan forgiveness programs. The second is to explore alternative options to cumbersome and confusing loan forgiveness programs. This could have high feasibility given that we have some existing programs in place that could be more efficient. The third is to expand funding and resources for education and professional development. As we know, clinicians coming right out of school, even master's programs, still need a lot of development, even in clinical modalities. And 4, to expand tuition reimbursement programs, subsidize training opportunities, and certification costs. As you can see, there is overlap in these 4 items, and our team will address that in our work plans. And finally, in this category, we place collaboration. This is currently a broad statement to foster collaboration across agencies and stakeholders. We saw this as high feasibility, and our task is to figure out what it would actually look like across regions and the state, and what the structure would be to make it consistent and effective. All right, could I have the hold off slide, please? We have 3 buckets in hold off. The first is culturally responsive workforce. And the item is to increase access to in-person and virtual behavioral health resources in rural areas with culturally competent providers. We place this here because it's very broad and also falls under other work we'll be addressing regarding access in rural areas. The second bucket is supporting workforce and has 2 items. Fund work-based learning experiences such as internships, residencies, and apprenticeships. And the second one is to subsidize clinical supervision. While we think this is a great entry into our field, we placed it here simply because of fiscal constraints. The third item is a compensation item. This involves subsidized housing, relocation, childcare costs, and particularly in rural areas and underserved communities. While this would be great, we put it on hold off because we saw this as an area of less impact than direct compensation and would have a significant fiscal impact. This is very common in the for-profit field, supplements around these areas, but it's going to be a tough haul in nonprofit. Let's go to the due later slide. In the due later category, we have 4 items. Under compensation, redefine and provide the resources to community mental health work as a sustainable career choice rather than a stepping stone to private practice. Frankly, we feel that if we do a good job with compensation and supporting workers in the other categories, that community mental health work will emerge as a sustainable career. Our next 2 items have to do with supporting workers. Pair acute clients with appropriately trained providers. Now, this is a complicated area in that while we want acute clients to get care from highly trained clinicians and experienced clinicians, a high acuity caseload is a fast road to burnout, even for the experienced worker. Also, at some point, an inexperienced clinician must get experience with high acuity clients, which implies the development of perhaps a different supervision model for high acuity services. While this item is important, we feel that we'll get more bang for our efforts on higher priority items. The second item regarding supporting work is reducing staff to client ratios. Now, high caseload is a very common complaint from clinicians and often leads to retention issues. However, this issue cannot be solved until reimbursement rates to providers support lower caseloads. And then finally, regarding incentives, we need to craft a set of statewide initiatives to provide early career explanation, appropriate work-based learning experiences, and career guidance based on individual interest, skills, and career fit. We're not sure about the impact of this. There are school districts already providing some of these programs in the space to build on, but we didn't think it should be our primary focus. Okay, I'm going to go to the stakeholder engagement plan overview, and then we'll take questions. So one more slide. Yeah. So we have a very extensive stakeholder list, and so I'm not going to go through it all today because we need to continue to refine it as we develop our work plans. However, I do want to mention that there are 2 workforce groups which are working on issues that have many and obvious overlaps with our work. They are House Bill 2235, Behavioral Health Workforce, and House Bill 4092, Admin Burden. These folks are doing great work, and we intend to invite these work groups to share their recommendations with us and gather insights that can help inform our council strategies, avoid duplication, and elevate our shared priorities. Okay, that was a lot. I'll try to answer questions, and I would ask my teammates to help me out with that. Bethany, is that a hand? Oh no, that's my hand. That's my cursor.
I was gonna say, I don't think so.
My cursor is a hand. No questions. Wow, I'm getting off easy.
I think you've done a great job.
Oh,
I think that I think that I think this was a very I will say I think it's very thorough, and I think I appreciate that you are holding both truths and knowing that there needs to be some further work on compensation and how to do it, and using the experts to come up with the right matrix. And at the same time, I think what's particularly challenging is, you know, the funding picture continues to change, and the key is retaining the workers that we have right now. Right, because that has to change, that has to be a priority and continue to be a priority. And so I think you all have just done a great job of shifting. Because I think that you've had to really shift quite a bit with the federal funding picture. And so I just want to tell you I see that, and I really appreciate it.
I am really proud of our team for balancing what we feel is the right thing to do with what we know is the practicalities of our environment, and still staying hopeful that we can make changes for the future. I think our team has done an excellent job of balancing that. We've had some great discussions, and I'm really looking forward to diving into the work plans.
I would also say thank you for being very specific about the work groups. We'll talk about that at the end. Know that staff is also part of the role that staff is doing, is going through and looking at who's doing what, because it's exactly right, and making sure that we can be inviting folks. And at the end of the day, that everybody's going to get behind this stuff and push, because it is not, there has been a task force, there has been this, there's a lot of great ideas, and none of them are going to go to waste. The goal now is everybody is going to get behind things, and that we can continue to engage all of the people who have worked on these various committees to help us do the work, right? And so I've been starting to talk about it in terms of a coalition effort, instead of this is what they've done, this is what we're just doing, one leg of the race. And my hope is at the end that everybody gets together, because these are the folks that have spent the time on it, and are very invested in the outcome. So great work. Does anyone have any questions? I think you guys have just done a great job. Or anything you want to say? Okay.
Can I chime in real quick, First Lady?
Mm-hmm.
I would, I appreciated, Julie, you commenting on the conversation that we had around DEI specific buckets. And I guess I would encourage every subcommittee to think about that, because there are DEI related initiatives in every subcommittee. And so really our conversation was about like overlaying every single piece of the work that we're doing through that lens, because if you do DEI work as a postscript or a little bit of lip service, things don't really get done. So our effort is to, again, like Julie said, to embed. So I would just really encourage that that's the work of the council as it is the work of our particular subcommittee.
Thank you for that. Okay. Robin, are you feeling ready to go?
Definitely. Taylor, before we bring up the slides, I just want to invite the members of the subcommittee, if you would mind, just to raise your hand so that we can say thank you to the people that are part of the work. Janie, Alice, Tammy, thank you so much. There's some, Monica, there you are. There's a couple other folks that are not present today, but I'm going to share what came out of our conversations. And at any time, if anyone from the subcommittee wants to jump in, please feel free. This is all hands on deck sort of thing. So thanks. And Taylor, you can bring up the slides when you're ready.
Full transparency, Chad took over and that's why it's going so well. So Chad gets credit for the operation of the slides.
Nicely done, Chad. So appreciate it. And Taylor, you're doing a great job. Come on now. Um, I'm happy to go through this. I just want to share before we jump into it, our subcommittee took a much higher level view of this, and we really went through the prioritization list as kind of the instructions from the beginning, as a plan to make a plan. So I don't have a lot of details to share with you all. It's more of what we're thinking about, what we want to prioritize and focus on. And I'm not going to get into the weeds with you today, but I promise that we're going to get there as we do the work. But today it's pretty high level from our group. So the other thing I just want to say before we get into our slides is that we're all, as you know, all the subcommittees are working towards the same outcome, and that is to share what our recommendations are by applying the prioritization framework. So the thing to keep in mind for us is that we are also acknowledging that we are sharing some priorities. So there may be some that are listed for our committee that may not pop up that you're expecting. And it's because another subcommittee has ownership of that. And it doesn't mean that we won't weigh in. It's sort of like that comment from before, where do we cross over? So we're acknowledging that as well. Chad, do you mind going to the next one? Thanks. So we're using the same prioritization framework as everybody else. For us, the things that we wanted to keep in mind, and maybe this was the same for the other committees, was really thinking about one, cost. So just given the current environment, especially, you know, around education and training right now, what is going to make sense and that's going to have a significant fiscal impact, but it's not going to take a lot of resources. So what are we thinking that's going to be feasible? Really what we're focusing on is high impact at no or minimal cost, kind of bottom line with that. But we're also taking into account the administrative burden and keeping in mind that the staff and the folks with the government or the governor's office are going to be able to help agencies work on some of this stuff. And so something that might be hard for an agency could be easier with the governor's support. So we're keeping those things in mind as we're thinking about feasibility. And so just know that's what's happening in the back of our heads as we're thinking about the list. All right, Chad, we're ready. So here it is, the plan for the prioritizing the recommendations. This is our do first list, and we have two slides. We're an ambitious group, I will say. So, and we also have categories, but they're not showing up on the slides right now. So I'll let you know that the three categories or buckets that our do first recommendations fall into are improving communications and transparency about behavioral health careers, developing and streaming clear educational and career pathways, and enhancing partnerships and collaboration. So those buckets are in here with the list of priorities. We have ours so that it literally is the top one is our do first, and the second one is that's kind of how we're thinking about it. So that's why it's not split out into those buckets. But those three buckets are kind of the things that we're thinking about. So for improving communication and transparency about behavioral health careers, this theme focuses on making the behavioral health sector more understandable, attractive, and I would say accessible to a broad audience, because we need to be thinking about how do we get younger folks like high school students engaged, as well as all the way to legislators and those thinking about a career change, right? So we really want to be able to figure out how we're communicating behavioral health. So we've tried to find ways to combine priorities, and in this section, it's a great example because there's one priority that has design and dissemination of marketing, and the other one is creating clear and consistent language to define behavioral health. So these two efforts can be combined, and I think that's going to give us more bang for the buck as we think about what's the work we can accomplish as, where can we overlay some of the things so that we're doing more than one thing at a time. And not surprisingly, as an education and training subcommittee, another theme is developing and streamlining clear educational and career pathways. So this theme addresses the need to evaluate, define, and improve the academic and practical routes into behavioral health, ensuring smoother transitions and better preparation for folks that are going to be coming into our field. So that's a really important one. Chad, can we go one more? So this is the second slide of all of our do first recommendations. As I said, we have hopes to accomplish big things. But the third theme is around enhancing partnership and collaboration. And so this theme emphasizes the importance of ongoing cooperation between educational institutions and employers to strengthen the talent pipeline into the behavioral health sector. So I just want to acknowledge that I know there are quite a few recommendations that landed in do first, but remembering this is just our first take at this. We expect that number to shift as we start digging into the recommendations. So things are going to move around as we go, and we know that. But as you can tell, there's just a lot of things that are sort of rising to the top. And then as we start to figure out what would it actually take to do that, things will likely move around. All right, Chad, you ready? Thanks. So these are our do next recommendations and thinking about the low or medium feasibility but high impact part of it. And we only have one slide for this category, I promise. And we can drop the buckets into this one as well. So enhancing financial and structural support for educational pathways is our first bucket. And this theme focuses on addressing financial barriers and systemic limitations within the educational system to increase the number of behavioral health professionals. So there are a lot of barriers to getting the education that we need, and our subcommittee is highly aware of that. And so that's a big piece that we're going to be trying to unpack is how do we just make it easier to on-ramp people into the space. Developing innovative and structured educational and professional pathways is our second theme. And this theme centers on creating more formalized and effective educational models, including continuous professional development, so that people can get better prepared and be better retained in the behavioral health workforce. So that's an important one. And then the last bucket is focusing on culturally responsive and rural services. So that's really thinking about the importance of tailoring education and support systems to meet the specific needs of diverse populations and underserved geographic areas, of which there are many in our state. So just holding that to be true. And I think this also speaks to the comment that just came out around DEI and that needs to be layered into everything that we're doing. So I'm feeling that as well. All right, Chad, we're ready. And then our third kind of piece around holding off recommendations. You'll notice there's only a couple here that really fell into this area for us. And these two recommendations specifically apply to community colleges and are being recommended to hold off either because they're in the process of already happening or the lack of capacity to address the recommendation. So these are something that maybe we would want to come back to later, but for right now, we're suggesting that we hold off on this. All right, Chad, we're ready for our due later recommendations. Thank you very much. And remember that these are categorized as having low feasibility and low impact. So there are only a few recommendations that we believe will need to be addressed later, and these are primarily due to high resource needs to address the compensation and funding. Just like what was shared by Julie earlier, we know this is important, and the reality that we're currently existing in as far as resources and specifically financial resources is not high. And so we're being realistic as much as we can. So I would just say the second recommendation is set to do later because it's believed that the breadth and availability of degree programs it's not a constraint at this time. Mostly we have access to different programs, and even if they're not at specific institutions, because students and learners can access things remotely, we believe that that is being taken into account. And so, as part of access to learning. So that's an important piece as well. I think we can go ahead and move 2 slides forward so we get to the stakeholder engagement, and then we'll do the questions for discussion afterwards. But the stakeholder engagement plan overview, thank you, Chad. Well done. This is the same kind of stuff that each group has been looking at, and similar to all the groups, we've put together a really juicy list of folks that we want to make sure that we talk to and engage with. You can see that the list we have general categories, and they include experts in education programming, marketing and communication, student and adult learners, as well as behavioral health providers and center representatives, not to mention a variety of boards, councils, and commissions. So I am sure this list will continue to refine and narrow as the action plans develop for identified priorities, but we've got a lot of folks that we know we'd like to tap into, and then we'll connect with them in a way that makes sense as we figure out what's needed. Okay, I think we're at our final slide around Q&A. Oh, that was the list that I just read to you. So yeah, we can just call it.
Oh, and Robin, let me jump in right here to say, great job on that. That was also across committees when people started to the gigantic list of great people of expertise, and then it was sort of like the list gets really large. And so then the thinking that you all had is the more we get into specific recommendations and then are asking for stakeholders and subject matter experts per each recommendation and plan, that would be a way to narrow it. So everybody kind of came up with that same conclusion. So I just wanted to flag that for all the committees, as you had big, large lists that were all good, but then thought, well, maybe we'll get more into the weeds per each one, and that will help us narrow it down. So everybody, and that was something we all learned by doing, which was a great suggestion and a great plan. And so we're gonna switch that up and follow that, and then I think we'll get more specific. So great job.
Yeah, and I appreciate how there is so much crossover and sort of what we're thinking as we're going through these. That there's a lot of connecting, and I'm imagining you all are seeing that as well. And to me, that's very affirming. Like, oh yeah, we're all going in the right direction because we're kind of supporting that in each other. So I appreciate hearing people's thoughts as you're starting to develop your list, because it's like, oh yeah, that makes sense for us too. I don't know if there are any questions or if anybody from the subcommittee has any comments that they'd like to jump in with. Hey, Rachel, what you got?
Hey, Robin. So I just wanted to comment on one of the ones you mentioned about increasing pipeline. I think it's so great that the First Lady and the Governor's Office and everybody is really seeing that the PHMPs, the Psych NPs are the biggest prescribers. And you had mentioned something about pipeline, and I know we're all looking for kind of those subject matter experts. And in an interesting turn of events, considering grants are getting cut, there was a federal grant
Right.
given to
Yeah.
the co-director wrote this at the Psych NP program at OHSU, and they received the grant funding. And it is all about increasing the pipeline for psychiatric NPs, really focused on rural areas and the high need urban communities and funneling them towards child and adolescent population and eventually creating a bigger pipeline. So I just, since you had that, wonder if we can make that connection for you, because then maybe the state partners and does that or learns about it, because it just sounds like all the grants getting cut and then this one happened. It might help you all.
Yeah, that sounds fantastic. And I appreciate people being able to plug in from their areas of work because, like Eli was saying earlier, we are the people that are in the subcommittee, we have those specific lenses. And so, absolutely, Rachel, it'd be great to bring in some of those voices that you think can help support this work for sure.
Thank you.
Yeah. Hey.
Hey, I just wanted to add to that too, and again, maybe this is like a little bit too in the weeds, but thinking about as we're thinking about psychiatric mental health nurse practitioner, like pipeline development programs, and this is also true for master's level folks who are doing practicum and internships. But we talked about this in our subcommittee a little bit yesterday. We need to figure out how to make their learning experience in their site settings manageable for them so that they don't have to go elsewhere for their clinical hours and then we lose them, or that their clinical learning hours exceeds what then they're able to accomplish in their role that they're hired to do, right? So I have a psych NP right now who we've been supporting through her learning, and now she's going down to half time because her clinical hours are too much. She's doing them in a different setting. I'm going to lose her long term.
Yeah.
And we've invested in the training only because her educational requirements don't support my retention goals. So we need to get on the same page in that regard.
Yeah, Shira, so appreciate you lifting that up because actually Clarissa and I had an earlier conversation about how do we make sure that all those different education pathways are being addressed. And so let's just keep coming back to that because you all are coming from different pieces in the behavioral health workforce. And what are the things that you're noticing in those education and training pathways that need to come into the space for our subcommittee? So as those things keep coming up, please feel free to either email me or have some communicate any of that because all of that is helpful in the work that we're doing. So thank you for lifting that up. I appreciate it. Liz.
Yeah, I just wanted to say that that's true for MSW too. Like I was in an MSW program and I stopped it because of the internship piece because I'm seeing like interns do the exact same thing that I'm doing, but it doesn't count. So yeah, it's very applicable.
Yeah. And Liz, I feel you are not the first person to tell me that they got through their MSW and couldn't do the internship stuff and and had to cut their learning short. So yeah, how do we pull in what we're all observing and hearing from the different pathways so that we aren't losing anything between the cracks, right?
Yeah, for sure. It's just not feasible to like not work 40 hours a week. So you got to give up one of them.
Right, exactly. Yeah. Yeah, I feel that. I so appreciate the engagement that you all have and just sharing your thoughts around this. I know the education and training piece is such an important part of how we are growing our workforce and keeping people engaged. And so I welcome everybody's feedback and understand that I think it doesn't matter where you sit, that there's something that's impacting you around education and training. So please know that your voice in all of this is very welcome. And I'll just share that our next steps from here is we're going to keep working to narrow down the prioritization. So we're not trying to do that. We're not trying to eat the elephant in one big bite. The plan is to identify and match up stakeholder engagement with refining our priorities and making sure that they all fit, as well as getting those subject matters connected and getting that information to help inform our decisions. And then making sure we have a good timeline and implementation plan for meeting with stakeholders because that's going to be super important. But in all of the work, I just want to say that we have an amazing subcommittee, and I think we're all excited to dig into the work. So thank you so much, First Lady and Taylor, for kind of launching us into this, and we're excited to make it happen.
Can I pop in as a member of the subcommittee? And I just want to thank you, Robin, for doing such a great job of explaining this. We were hard to wrangle, if you can't tell, based on what we came up with. But I also wanted to point out, and this is based on both Shira and Liz's comment, that in our subcommittee, I think more when we were talking about stakeholder engagement, we want to be really sensitive to the different regional needs and priorities. So we sort of sometimes collapse like rural as one thing. And so we really, again, in terms of thinking about the reason it connected to your comments is I was thinking about in areas where you have somebody and you're working on retention and they're doing a degree and you want them to keep doing the degree, we need to find ways that are creative and robust to keep people providing the needed services in areas where they're really deeply needed. So I just wanted to throw out there that like I think we had really good conversation in our last meeting about sort of how to be regionally specific in terms of some of the data that we're gonna want to keep gathering. So anyway, thanks Robin for wrangling us and presenting.
Yeah, and thank you for jumping in, Alice. I really appreciate that. Yeah, because it takes a village, right? Yeah, thanks.
This is so good. I am so excited. It just feels so wonderful to see all of your expertise coming together and having people be like, yes, this is happening here. And yes, uh, so we just love to see it. We just love to see it. And we've been getting feedback that that people are enjoying the work in the subcommittees and you're working, workshopping the things that are exactly right. And identifying, yes, it's hard for somebody to have their practicum and another job when they're working in the field. And how do we count that? That's all the right stuff. And some of that is stuff that you only know from doing that work in the field, because they are your students or you're one of those students trying to make it work. And you end up being the very person that blows out of the practice because and you're the one who's already there. And so it's a great example. So I'm gonna close this out, but I'm gonna jump priority order. Sorry, Taylor, I hope it's okay. I want to because you when we looked at your subject matter experts list, who was not on it was you. And that is what needs to be different, because many of you are doing some great practices where you are. And so one of the things we want to do for the next meeting is create opportunities for people to highlight that. Because some of these recommendations, right? Some of these are places where you've gotten to try things and see what's working. And so it's really important that we have an opportunity to lift those things up. And I also have been out in the field visiting different so I've been able to go to some of your work sites or be on or work with some of your students, and so I know that. And so we realized there really wasn't clear in how we set this up. So what we decided is let's start having some best practices come up to the full committee, and so that was the way that we thought we would start help with some of the fleshing out of recommendations. So the next agenda will include presentations from primary licensing and credentialing boards, because we all have a little bit to learn there, right? Because you know the credentials that you know, but not the other ones. That's okay. But that's why we're going to specifically have the licensing and credentialing boards help us understand that a little bit better. And then, we'll have some baseline knowledge. We are learning from these, from the engagement and the stakeholder engagement and the SMEs, that there are some crossover people. And so give us a little bit of time to figure out who those are and then figure out who we should ask back to the full committees, or if it makes sense for them to come to your subcommittees. That'll kind of be something that we figure out. So following the August council meeting, that's we'll have best practices. And so what we're hoping is that at an upcoming subcommittee meeting that you and we'll work with the staff to just ask for feedback on best practices that you recommend that we highlight. And that could be things that are happening in your organization. If there are things that you've heard of that you think are the right, just stuff that we know. What we're really looking for is things that have a little bit are implemented now and working. That's really we can talk about things that would be great ideas, but these are the things that are just happening and that are seeing some result. It doesn't have to be there very long. And don't be shy about it being your organization or your experience, because that is part of the value of this team is that there's a lot of great things that are happening. So with that, the next meeting is August 14th from 2 to 4. You should have received the calendar invitation. You can reach out to the amazing Chad And thank you everybody for the warmth and the respect and the admiration you have shown to the brilliant staff that are on this team. They are incredible. Thank you for seeing that and supporting them. You will receive the materials 40 hours in advance. Taylor is great about that. Talk a little bit about what's going to be on the agenda. And then, as always, reach out with recommendations, things that you want to add. I'm going to go to Shira because she's already doing that.
Sorry. Just,
Yeah.
I'm going to be on vacation for the next meeting. So I was wondering about designee. Do you want me to send someone in my place or just not be here for that meeting?
You know, I am fine if you would like to have somebody come in your stead. You can always watch it. So that is, you know, let's do something. Let's just try to, can we do a little show of hands real quick? This isn't inexact, but, I think if people wanted to have somebody to be in their stead for a meeting, I don't see a problem with that. But I kind of look for, I'm facilitating. I really am interested in what the council thinks. So do people feel okay about having people sub in if they're going to be gone for a meeting? Can I see a thumbs up or a yes? Okay. Looks like I'm seeing a yes. I'm seeing lots of yeses. Okay. Yeah, I think that's a great idea. If there are points you want to make sure get brought up or I think that's totally fine. And obviously, of course, you can always go back and watch it, but I think that would be appropriate. And it seems like everybody agrees with that could work just fine. Taylor?
Yes, just a logistics ask on that is to just let the staff team know in advance because we allow folks into the space based on who we know is coming. And so if we know that they're your designee, that helps us to know to let them in to the room. So please reach out.
Yes, and we want to kind of keep that to a minimum only because you're establishing some important group dynamics and you're working together, and then it can it's taken us a while to get to know each other. It's always interesting when you're on camera and people are kind of ebbing and flowing into this. So keeping the same cast of characters as much as we can, but I never want to, I always think, I think it's okay to have somebody swap in, but just, and advance notice so they can follow all the right protocols. And we are doing it as 3. Oh my gosh, it's 3. Okay. Well, again, thank you to everyone for your time. Thank you to the staff. Keep moving forward on your incredible subcommittee work. Let us know what you think what should be happening in the future. And it's an honor to spend time with you. All right. Take care. We'll see you in August.
Thanks.